Hello, I'm Bobbi Herzberg, and I'm a Distinguished Senior Fellow at the Mercatus Center. And I'm here today to share with you, I hope, an excellent discussion from a couple of great experts in the field of COVID and COVID policy and health policy more generally. Of course, this is a subject matter that has been on all of our minds, and unless we're under a rock trying to protect ourselves from COVID, we are probably familiar with some of the questions and debates that have been going on what is the right response to this. How do we get through a public health crisis such as this? What are some of the trade-offs that we deal with as we move forward? And so today I share the forum with, as I said, two great experts in the field, Dr. Jeffrey Singer of the Cato Institute, and of course he works on the Department of Health Policy Studies there. Additionally, of course, he is a practicing physician, a practicing surgeon, and he is, in fact, later today has to go back and perform surgery and go to the hospital afterwards. So he can bring a very interesting perspective, both from the perspective of academia and the liberty movement, but also from the practical experience that he has observed in his own career. Additionally, we have with us Dr. Kristian Niemietz, who's at IEA, Institute of Economic Affairs out of London, and he too has a long background of dealing with health policy issues and issues of welfare and political economy, and he has a PhD from King's College London. And the way that we've organized this today is I want to start out with a sort of broad overview from each of our guests, and I've asked them to sort of focus regionally. So Dr. Jeffrey Singer will deal with the US primarily, but of course he has experience and knowledge more generally, and he'll add to that. And Kristian will deal with the issues of the rest of the world, which of course is a big load to carry, but I'm sure we can have a great discussion about this. And so I'd like to begin with a broad overview, asking them to explain to us where we are right now with respect to COVID-19 and what we learn from our experience in the spring that may help us as we navigate our way through the second wave that we appear to be in both in Europe and in the United States. And as each of you are trying to outline this for us, you might suggest where you think we are with respect to a vaccine. If you want to talk a bit about that and whether or not that is our end point in terms of some of the challenges of our policy, and whether you think some of the good news on the vaccine front that we've heard very, very recently is enough to move us beyond this crisis. And so I open it up with Dr. Singer. Why don't you take it away?
Thank you, Bobbi, and it's great to be here. Where we are right now is we know a lot more about this virus, of course, than we did about 10 months ago. I don't know if it's really accurate to call it a second wave that we're on. I think this is all just one wave, and it has periods of where it's more active, which may be related to when people are kind of coming out of restrictive environments and getting more out there where they get exposed to the virus. But I think we've learned a lot, and what we've learned first of all is from a regulatory standpoint, how the regulatory apparatus, particularly here in the United States, where I'm more familiar, has really made our response very flat-footed, very sclerotic. So, for example, in our country, once the RNA became available on this virus and was made available to the world, the Food and Drug Administration essentially gave a monopoly status to the CDC to develop a test, and pretty much sent message out to every other private sector and even public sector laboratory that the CDC has got this. And then the CDC about a month later came out with a faulty test and not enough tests. And then the FDA had to play catch up, and eventually allowed the governors of the 50 states to make their own determinations as to which tests they wanted to make available. And so that, I got to get that off there. So that was a really good thing that happened. That's a bad thing that happened. Another thing that we learned is how in our state, we have 50 different states with 50 different professional licensing laws. And the licensing laws interfered with the ability of healthcare practitioners to move between states. In several states, governors temporarily suspended the licensing requirements so that physicians and other healthcare practitioners licensed in any of the 50 states could move into their states to render care. Same thing when it comes to physicians from outside the country. Some states allowed them to come in. So we learned a lot of about how the regulatory apparatus basically stalled a rapid response. Also, I'd like to think that a lot of our governors, because in our system, a lot of this is taken care of on the state level. We're a federal system. And some governors did complete lockdowns. Others were much more lighter, had much more of a lighter touch, something resembling more of what they did, for example, in Sweden. And what I think we've learned is that now that we know much more about the virus, we learned that it's primarily dangerous for people who are over age 50 and particularly have other medical comorbidities. For the young and healthy, it's probably less dangerous than the so-called common flu. And a lot of the governors of the various states have learned from their mistakes of perhaps overreacting early on. And now that the virus is making sort of a resurgence in many of the states, the governors are a little reluctant to, and depending on the state, many of the governors are reluctant to reimpose those one-size-fits-all rigid draconian lockdowns that they did early on, and they're adopting a more focused approach. As far as the vaccine is concerned, of course, we all learned the great news the other day about Pfizer coming out with a vaccine. And I think one of the important messages people need to know about that was done with completely private money. There was no government money involved in this. This was a completely private sector enterprise. And I think another lesson we've learned around the world, because other countries, of course, allowed their private sector to get going, ironically, with less regulations than the U.S. did. And the U.S. has the reputation for free enterprise, but in other countries, they were actually they were more liberal in terms of allowing private operators to get going. And what we've learned is how rapidly the private sector, as opposed to the public sector, can respond to changes, to quick changes in whatever is going on. They're much more, they can make much more rapid adjustments. Dealing with the government bureaucracy is like trying to turn around an aircraft carrier, whereas private sector using local knowledge could respond much more nimbly.
Thank you so much. Kristian, we'd love to hear from you.
Thank you, Bobbi. Well, what have we learned? That depends on who we are talking about. I think the people who are actually involved in healthcare, the people who are working with this, they have learned a lot. You can see that the case fatality rates for people who are hospitalized are a lot lower than they were during the first wave, which suggests that healthcare workers have gotten a lot better at dealing with this. You now have much better chances of surviving it, even if you are hospitalized, even if it is a severe case. In that sense, the actors in the healthcare systems have learned a lot. On the policy side, though, there it looks a lot bleaker. I guess the lesson that we should have learned from the first lockdown is that what a lockdown can do is buy you time, but you also have to do something with that time. You can't just lock down and then say, okay, let's just see how it goes. And you have to do something specific with the time that you're buying, either expanding the capacity in the healthcare system, or get a contact tracing system up and running, or whatever it is, have some strategy in place for after the lockdown. That has worked in some places. In Singapore, they had a short lockdown in, I think, late spring or early summer. And that was, I think, specifically because their contact tracing system was overwhelmed. They got cases down through their lockdown. And then from then on, their contact tracing system could take over and they could more or less get back to normality. Whereas here, lockdown ended and pretty much nothing was different. The post-lockdown world was the same as the pre-lockdown world. So unsurprisingly, the whole thing just came back and flared up again. And then we even had the government subsidizing that. We had, for a while, you were subsidized to go to restaurants on specific days of the week. And then surprise, surprise, it later turned out that that contributed to the rise and the second wave. And it is part of the reason why we are now where we are. The trouble is there aren't many success stories. The success stories that we have are really the Asian countries, Taiwan, South Korea, Singapore, and Hong Kong. And that's why I'm not quite convinced by the idea that we needed the experience from the first wave or anything. We could have just looked at what they're doing. I often hear the argument that that's an unfair comparison. You can't compare Europe or America to Asia because they had the experience of the SARS pandemic in the early 2000s. Well, okay, but the knowledge they acquired through that was not kept secret. They didn't hide that away. We could still have learned from them. There's many bad things that I've never personally experienced, but I still know how to avoid them. And why couldn't we have done the same in this case? Taiwan in particular, the big success story, early travel ban, testing and tracing up and running quickly, quarantining the people who tested positive, and it's all worked very, very well. Their economy isn't even shrinking. They've had, I think, 6 or 7 COVID deaths overall. So it's more the only thing that we're really learning from each other is that as soon as one country goes into lockdown, all the others seem to copy it because they get panicky. But maybe that's not the thing that you really want to learn.
Well, each of you, do you think though that the strategy that has been used of lockdowns and of sort of excessive, would the kind of strategy that's worked in Asia work in other areas of the world? For example, in the United States, one of the challenges that I think we've seen is freedom-loving people are hard to contain, and that's we're American and we're not going to take it anymore kind of an attitude sometimes with regard to decisions coming out of authority systems. And additionally, maybe underlying health considerations as well. There's suggestion that obesity and other health concerns are related in some way to the prognosis and mortality and morbidity rates under COVID. Do you think that the same kind of strategies, watching what happens in Taiwan, for example, can be used in the United States or in a number of European countries, in Italy or Spain, for example?
You want me to go first?
Please.
No, I think you raise some very valid points. Number one, different populations of countries are different average age. Some are healthier than others. I understand, for example, in Italy, particularly Milan, where it got hit very hard, they tend to have an older population that is actually less healthy and tends to live together in closer quarters. In Asia, I don't think they have the obesity problems, for example, that we have in the United States and other Western countries. But then the other point about contact tracing, which is very important. Notice that in Taiwan, they didn't quarantine the well. In the Western countries, we're quarantining everybody, which is completely opposite of everything I was ever taught as a doctor. You're supposed to quarantine the contagious people and let everybody else go on about their life. Here, it's sort of like just, scattershot. We're just quarantining everyone. But in order to have accurate contact tracing, there may have to be invasions of personal privacy that I'm not sure we would tolerate in the West. And, there are ways it can be it can be done, but you have to do it in a way that's very protective of your privacy. And so it would be very difficult to come up with a way of doing it in Western countries that would satisfy the other greater value we all have, which is personal liberty. And then, these are things to keep in mind. What was the other point you're making? Well, that's it. I'll let Kristian answer the rest.
Yes, Kristian.
I think it broadly could have worked. Yes, I remember in the beginning, during the first wave, that argument was often made that that Asians are just for cultural reasons more compliant, and we Westerners, we're freedom loving. But it didn't really seem that way. There was a very high degree of compliance, and more importantly, high rates of approval for all sorts of restrictive measures. Whenever a politician announces some new restriction here, there is a YouGov poll on that the next day, and it always shows immensely high rates of approval. So the idea of the freedom-loving Westerner is, I think, a bit of a myth, at least during the pandemic. And I personally wouldn't have had a problem with something like the South Korean approach, where yeah, Jeff is right. If it's from a civil liberty, privacy perspective, it isn't great. It does mean that the government does track your movements. It wasn't just voluntary contact tracing. It did mean that they were checking credit card details, seeing where you were at a particular time, making a transaction, and so forth. I wouldn't be thrilled about that, but the thing is, there the government tracked people's movements, but at least there people had movements. At least there were movements that you could track, which I think is preferable to what we had here. I couldn't think of more extreme measures than the ones we had. And this selective targeted approach is clearly from a pro-liberty perspective preferable. But if you want a targeted approach, then the government needs to have the means to do the actual targeting. And that means some violation of privacy rights and civil liberties.
Well, I think this raises the entire issue of trade-offs that are everywhere in making any policy, of course, but certainly have come right to the forefront with a complete lockdown and sort of seizing of all normal life. Those trade-offs, I think, become more apparent than they might with other policy issues. So in considering those things, not just the economy, which of course that became a banner in a lot of the politics. It's all about the economy, but we care about the well-being of people and their health. But we now know that, of course, well-being and health and other trade-offs are being made as well, in addition to costs in social relationships, access to preventive services, for example, have been raised as perhaps creating additional health issues down the road for people. All of these have been attributed to this excessive policy, perhaps, of the lockdown. So when we face that kind of trade-off, how should democratic societies make these kinds of choices? Should we rely on science and the experts? And what does that mean in the context of a policy that is as broad as the implications of COVID have been? And perhaps sort of discussing that, you might talk a little bit about some of the controversy or disagreement within the expert community, and in particular, the Great Barrington Declaration suggests that the experts may not all agree on what the correct policy is with respect to this issue of lockdowns and heavily restrictive policies. So could each of you take that issue of trade-offs and where we should go on this?
You want me to go first?
Yes, please, Jeff.
Well, I was mentioning before we went live, as I'm a clinician, and it's interesting, there's a lot of my fellow clinicians seem to generally be a little more sympathetic to the authors of the Great Barrington Declaration than the academic and research people in my field. And maybe that's because what we have to do every day as clinicians is take the science and then help our patients make decisions which involve sometimes very difficult trade-offs that they have to make. So we, in our daily work, are very sensitive to the notion of trade-offs. Now, we've seen over the past several months now, there've been major trade-offs, mental health trade-offs. In many countries, they're still, even in the United States, not completely having K through 6 school open. And there's some critical milestones in both cognitive and social development that children, particularly children in poor and inner city areas that don't have access necessarily to good, computer facilities, internet facilities, these could be permanent. This could be permanent public health consequences from this. We're seeing increased suicide, increased substance use problems. And in my field, we've seen a great, significant amount of delay in people getting necessary screening for cancer. We're seeing people show up now in advanced cases of cancer that would have been caught much earlier. And when it comes to surgical emergencies, people are presenting to the emergency room with surgical emergencies that I haven't seen in ages because they've been letting, let's say, a ruptured appendix go for days before seeking attention because they were afraid they'll catch the virus, even though their risk of dying from the ruptured appendix is just, magnitudes greater than the risks of them dying from the virus. So trade-offs are very important. And one of the, I've written about this, one of the concerns is that when you ask public health officials to give their recommendations, they're going to understandably tell you what they know about how to control the virus. But they're not, because of what they do, it's not in their lane to be concerned about trade-offs. Economists, of course, deal with trade-offs as part of what they do every day. So I think true leadership actually requires getting input from the public health experts, but also getting input from the economists, from the social scientists, from the political scientists. And then a leader has to kind of put that all together and come up with some sort of holistic approach, because you can't just focus on one thing at the expense of others. And unfortunately, that's what's been happening too much in our society today. And finally, I don't think we should put as little decision-making authority in the hands of one or two people as possible, because there are normal dynamics at play where, for example, if a lockdown is lifted and then cases go up, the governor who lifted the lockdown gets all sorts of political grief from that. But what's not seen are all these other secondary consequences that I've mentioned, the trade-offs. So there's an incentive for the governor to maybe err on the side of being overly cautious. And that's why sometimes you have to put decision-making authority in one person's hands, but you should try to have it as decentralized and localized as possible.
Thank you. Kristian, you.
Yeah, and there are sometimes areas where there is an overwhelming scientific consensus on a narrow specific subject, and it's all in one direction. In those cases, it's perfectly fine to say, listen to the science. For example, one topic that comes up here every now and then is rent controls, where I, as an economist, always say, look, we've studied this for decades. We know that rent controls don't work. It always sounds a bit like a lazy cop-out. I'm appealing to authority, but it's basically correct. When you have, let's say, 30 studies on a subject and 29 of them tell you the same thing, then you can really say this is settled. There's no need to argue anymore. But this case is very different for two reasons. Firstly, in this case, evidence has been all over the place, so therefore there is no such thing as the science. Different scientists, different groups of scientists will tell you different things. Face masks are maybe the most obvious example, that in the beginning, the message being face masks are useless, don't bother with them, and then them suddenly becoming mandatory. And this isn't anyone's fault. It's just that there haven't been any large-scale clinical trials on this before, because we didn't bother. We were not in a situation like this before, and but it would have helped if scientists and politicians talking about this in public had been a bit more humble and saying, look, to be honest, we don't know much more about this than you guys do. We're doing this. We think this is where most of the evidence leads, but we could be wrong, and this isn't set in stone. So there's that. And then secondly, we should listen to experts in the area of their expertise. But in this case, we're dealing with something, as Jeff said, that there's lots of trade-offs, lots of different areas of life that are affected by this. And that means there is no such thing as an expert here. unless you are an epidemiologist who is also at the same time an economist and a social worker and a psychologist and all of that at the same time, then who is the expert here? There is no such thing as an expert here, because we have a very holistic, overarching situation that affects a lot of different areas, and you can't possibly be an expert in all of that. And therefore, the mistake that we're making here, I think, is presenting this as a purely medical subject when it really isn't. I would compare this to climate change, where if you are skeptical about drastic policies, you will quickly be called a science denier. Well, no, I'm not a science denier. I don't dispute anything that any climate model says. I'm just saying those models are fine as far as they go, but they don't tell you anything about the policy implications. They don't tell you anything about the economic implications that should follow from that. And therefore, there is no such thing as an expert in that area either. Or we had this here 3 years ago, or 4 years ago, in the Brexit debate, the debate about the EU referendum. It was all, listen to the experts. Well, this has never been done before. Who is an expert in this? How can you be an expert in something that has never happened? Yes, you can construct models that show you what might happen in a specific scenario, and then I'm not one who would dispute that. If that's what the evidence shows, fine, so be it. But a lot of this involves other areas, international relations, politics, in which where nobody can be an expert in all of that at the same time, and therefore, yeah, being skeptical about some of those pronouncements doesn't mean that you are a crude science denier.
Thank you. Jeff, I wondered if you might take this up first, but one of the questions sort of coming out of the chat as well is this issue of whether or not the policies that we're seeing put in place now and the reaction to this, and what some would argue is overstepping by the state, if those kinds of policies have changed the terrain forever, changed the environment forever, are they likely to live on even after there's a vaccine? Will we look for how to solve the next pandemic crisis? They do come along every few years where there's some discussion of global pandemics and so on. So have we changed the terrain in terms of liberty and in terms of the role of the state? Never let a crisis go to waste kind of authoritarian argument. What's your take on that?
First, by the way, I agreed 100% with what Kristian just said before, and it was very well put. My take is, I guess every person who's concerned with individual liberty needs to be concerned about what Professor Robert Higgs talked about as the Ratchet Effect. I'm very worried because, this is a true emergency or crisis, and so it's a legitimate function of the government if you believe in government, if you're not an anarchist, this is a legitimate role for the government to come into action here. But we're surrendering a lot of liberty, freedom of movement, how we could run our businesses. I can go down the list. And I really worry that once this crisis recedes, number one, everybody will have grown a little more comfortable having their everyday decisions controlled by regulators, and it won't recede to the pre-crisis level. Also, there's a natural tendency, I think, for most of our political leaders, like I alluded to earlier, sometimes it's just basic incentives. There's an incentive for them to be reluctant to give up the control over our behavior. Number one, because they're worried that if they give up too soon, it could have political ramifications for them. And number two, I think a lot of them start to like having that kind of control. So there's no question, and this is another reason why I think a lot of us, myself included, every time there's a sort of a government intervention that is suggested for the pandemic, my default position is this really necessary? There's some other way we can do this.
Thank you. Kristian, would you like to weigh in on the liberty question and the long-standing?
Sure. I'm normally very pessimistic about political trends, and that's mostly because every time I look at YouGov surveys. The policies that I hate most are always the most popular ones. The public seems to love all sorts of restrictions. But in this specific case, I'm actually more optimistic. And the reason is that it is true that in the past, crises have often led to an expansion of government, which then stayed that way. A good example from Britain would be that during the First World War, the British government brought in rent controls. In the 1980s, they were still there. So the government starts doing something and then it doesn't go back again. Or nationalizations or government taking control of various parts of the economy during the Second World War stayed that way until the 80s. But there is a difference here, which is that in these cases, there were people advocating those policies before. There was an ideological commitment. There had always been people saying that the state should run most industries or the state should control the housing market and so on. Whereas in this case, we're talking about measures that are really quite specific to this situation. There is no ideological school of thought that says we want people to stay at their homes or that has a view on how far the tables at restaurants should be apart. So therefore, these are just more specific measures that once the virus has gone or once it's reached levels where it's not dangerous anymore, there will be no one with a particular agenda of keeping those restrictions in place. That said, I am a bit cautious about, or what I'm worried about is that the pandemic will promote bad ideas. I have a colleague, Steve Davies, who is an economic historian, and he says this has often happened in the past with pandemics, that they led to a resurgence in aggressive nationalism and xenophobia, which then led to restrictions on trade and migration and so on. And that is something that could happen today again, that we all already have those calls that we should become more self-sufficient. We are too dependent on the rest of the world. We have to reshore industries, all that kind of stuff. That is experiencing a resurgence, and therefore indirectly it could very well be that even once the virus is forgotten, that you will still have people saying, well, the lesson that we learned from the pandemic is clearly that we should do this and that. And therefore, in an indirect way, it could lead to a promotion of statist policies. Not in the sense that the restrictions that we have now will just be locked in place like it was with previous crises. It's not going to be a copy of that. But more generally, it just tends to promote bad ideas.
Thank you so much. As you see, by the time and the great discussion that we've had, there's so much more we could talk about, but unfortunately, our time is at an end. I'd like to thank our great panelists, Jeffrey Singer and Kristian Niemietz, for all of the insights that they gave, and I'm sure that they'd be happy to follow up with people. I know IEA has a booth. I think maybe Cato has a booth, or you should check out who's in the area, I guess, displays, exhibit area, and find more information from these organizations and these great scholars. Thank you.